Hello, my name is Daniel Stillwell. I'm the editor of the IFTA e-newsletter, and we have with us today Chelsea Spencer. And we're going to talk to her about some of the work that she's doing here at and presenting on here at IFTA in Spain.
Yes.
So thank you so much for being here.
Yeah, thank you for having me.
Let's start off with who you are and what you do. So we work with people all over the world, and therapy looks different all over the world. So what kind of clinician do you identify as, and what does that look like where you work?
Yes, so first I'm a research assistant professor at Kansas State University. I am also a clinically licensed marriage and family therapist in the state of Kansas, and I have a private practice kind of on the side of working at K-State.
Sure. What kind of clients do you see or work do you do?
Yeah, so for most of my work, I work with people who've experienced trauma. A lot of times that's sexual violence or intimate partner violence, and then of course I also see people with depression, anxiety, but my specialization is trauma, and I am trained in eye movement desensitization and reprocessing.
All right. Yes, some people know it only as EMDR.
Yes,
so thank
EMDR.
you for the actual definition. So that's awesome. So working with trauma, you've also developed a research passion about how to understand and dig deeper into the precursors and what's causing what and all that type of stuff. So tell us a little bit about that.
Yeah, so a lot of my research is focused on risk factors or risk markers or factors associated with intimate partner violence, emotional, physical, sexual, as well as intimate partner homicide is something that I'm really passionate about as well.
Okay. So how does it all work? What
Yeah.
What are the takeaways?
So what I'm presenting on today is a paper that I did as a meta-analysis, which is an analysis that synthesizes all the current research that's been done on a topic, so it makes a nice presentation.
Yes.
I have a meta-analysis looking at risk factors of intimate partner homicide, which I'm going to view as the most severe form of intimate partner violence. And we're looking at risk factors of that, and I guess some of the top kind of takeaways of that is the strongest risk factor is if the perpetrator has direct access to a gun, which increases the likelihood of a homicide by 1,000%, which is shocking, right? But other really important ones are threatening with a weapon. Non-fatal strangulation is one that I'm really passionate about. It increases the likelihood of a homicide by 623%. So again, really high up there, and it's something that is often minimized by even the victims themselves, just often due to a lack of physical injury. And so I'm really passionate about educating people more about non-fatal strangulation, because it is such a top risk factor, as well as just it's so easy to minimize. And I see it, but I'm training students to be clinicians with clients, and so that's another kind of takeaway from the presentation.
I think the access to lethal weapons makes sense to most people. The non-fatal strangulation, are we talking in the sexual ways or in the aggression ways?
Aggression ways.
Okay.
Yes.
Okay. All right, because there could be other.
Yes. Yeah. So it's looking at it as like aggression. So it's not consensual.
Right. Okay.
The non-consensual.
That makes sense.
Yes.
All right. So, do you feel like this is something that you're able to educate people on, that people are like taking in this information well?
Yeah, I think most people are really open to it, because I talk a lot about what you need to assess for. So, for example, I think it's only 50% of victims have any physical injury. Easy to write that off, right? Like, well, I don't have any bruises or anything like that. But there are certain symptoms that somebody can have that like would warrant medical attention. So I'm trying to educate therapists who the victim might be talking to. We aren't medical, well, not all of us are medical professionals, that we might not know that. So like if there's coughing up blood, if there's soreness in the throat or difficulty swallowing, even days after, they need to go to the hospital, or the doctor. They need medical attention, at least because someone can be strangled and die weeks later.
Yeah.
Due to internal injuries.
Okay.
So.
How do you differentiate between intimate partner violence between partners and domestic violence or family violence. Um,
Yeah, so I would say intimate partner violence is between the couple,
mhm.
and then domestic violence is like expanded. So that could be child abuse, that could be just any family violence. So that's how I differentiate the two.
And when you're looking at these risk factors, do you parse all that out?
Um, so in my studies, we're looking specifically at intimate partner violence.
Okay.
And so there are studies, not mine, but they're like just at child abuse because it's probably easier to look at implications if we break that out instead of mixing child abuse and partner violence because they're different phenomena.
Mhm.
They're sure often co-occurring, but I would say when we're looking at risk factors, I would say parse them out.
Okay. All right. So what's next? What do you want to do with this moving forward?
Yeah, so research wise, I'm continuing to publish, and I really enjoy that. I want to do more looking at strangulation. I want to do more looking at homicide. They are more difficult, especially the homicides, a little bit more difficult to study than intimate partner violence because it's just more rare.
Right.
But I would like to expand, I think, going forward, like career wise, doing more work specifically on intimate partner homicide, doing more on strangulation because I'm really passionate about those topics.
Okay. Now, one of the interesting things about going to international conference at a especially since not every country has the same issue with guns
Yes.
that the U.S. does, where I guess most of your studies are
Yes.
pointing at. How do you take some of these concepts and generalize them or make them useful to other cultures and contexts?
Yeah. The gun piece is probably pretty U.S. specific.
Okay.
But I would say, I have other folks when I'm presenting say like, well, no, where I live, the problem is knives.
Mm-hmm.
Like, granted, I might not have a number, but it's the same thing. So, like I say, if you're working with a couple, or even a one person, if there's been domestic violence, I would say like, where do you keep the guns? Can you put them in a safe place? Can you store them, remove them from the home, much like you would if someone's suicidal?
Mm-hmm.
If you're like in my country, the problem is knives, and I mean, ask about that. Like where knives are a little bit probably harder to remove from the home than. But I would have that conversation. So if it's a different weapon that seems more prominent in your area, ask about that. And then I think the other risk factors translate, right? Like strangulation can happen anywhere. Even threatening with a weapon. Well, it's a weapon, not a gun necessarily. So I think it translates across. And we know intimate partner violence is everywhere.
Yes, right. Okay. Any other work that you're doing that you want to tell us about?
Oh man, right now we just published more meta-analyses looking at emotional intimate partner violence, and that one I'm working with a group of students, and they're not all out yet. Some are revise and resubmit. We have a few out, and that's kind of we're having a line of projects on emotional IPV. Just it's more prevalent. And I know just like clinically working with victims, a lot of times they'll say like the emotional abuse hurt more than the physical. Like that healed, but like those words are still with me. So we have been doing some on emotional abuse, and then those will be published soon, hopefully.
Okay, awesome. Well, thanks for joining us and talking about your work and your presentation. Let's end with something a little bit more fun.
Okay.
You are from Kansas. You are currently in Spain. Where else in Europe would you go if you could?
Italy.
Italy?
Yeah.
Why?
Good food. I love Italian food. Good wine.
Mm-hmm.
Beautiful views. History. I mean, I that's like my top bucket list is going to Italy. I just and I don't even have a particular place in mind. I was gonna go before COVID.
Yeah.
And then that trip got canceled. So it's still like my top bucket list.
It's still there.
Yes.
All right. Cool. Well, maybe we'll have to convince the IFTA people or whatever to.
I'd be there.
Yeah. All right. Well, Chelsea Spencer, thank you so much for being with us, and we'll see you around.
All right. Thank you.